We have invested millions into addiction services. We are, however, rebuilding from a low base. It means that we're investing in new beds in places where there have previously been none for addiction treatment. There is more to do. It is not done. And I think, you'll see from the investment that we've made, our acknowledgement, though, that this cannot just be about financing and supporting law enforcement alone. We have specifically, however, increased frontline policing and those working on organised crime, but at the same time invested heavily in supporting those who may find themselves in a case of addiction. It cannot be about one, it has to be about both, and that's what we've changed up as a government. Our view is that we are already investing in successful programs that have been shown to work. We've invested, for instance, and supported the drug and alcohol courts, extra beds, extra treatment across the country. We know, though, that there is more need out there, and that's why we'll continue to invest in it.
It's better than what we've got at the moment, which is actually not one bed per DHB. But Dr. Shane, obviously this is something we'd like to see increased. It's going to cost a lot less than letting meth take over our communities. We've certainly got one of the programs we've got will cost about $50 million, but there's other efforts that we have to do. There's obviously will be some reprioritising, but we're making meth a big issue for us. It is really sad that it's been put in the too hard basket by some people. This is classic National Party looking at the causes of it, trying to deal with the issues around it, and not deciding it's too hard. It's not too hard, it's really hard, but we can do it.
Well, if it's a practical policy with a proven ethic of working, we'd look openly at it. Except when it comes to the National Party and public health, you know what their record has been. An absolute 9-year disaster. Sewage coming out of the hospital walls in Middlemore, every DHB in massive debt, every area of expenditure had been cut back, and now they've turned up here after 2.5 to 3 years out and say they've got a new enlightened policy. Well, I'd like to see it. My eyes are open on it. My party's a reasonable party. Let's see if it will work. But again, the question is, where's the money?